So I'm going to demonstrate my technique for inserting Testopel. Testopel insertion is a sterile procedure, so we create a sterile field. Now, I use lidocaine with epinephrine. So the patient is positioned laterally. The sterile field is created in the upper outer quadrant of the buttock region. Generally, for repeat implantations, I'll try to alternate the sides. So we go to the upper outer quadrant of the buttock. I'll make a little stick now, a small wheel, and then I try to put the remainder of the lidocaine with epinephrine deeper into the subcutaneous tissues where the implant is going to go. Little stick, little pressure. Try to make a nice wide field. I push up on the skin to try to get the lidocaine a little deeper and a longer field of numbing. So I'll push up. So he should be numb for about this distance, which will more than accommodate the trocar. So then we'll make a little nick in the skin. Then we'll use this trocar. So it's passed along in the field of the lidocaine. Try to get the trocar right so the opening is very close to the skin. So we want to try to get the pellets as far from the skin edge, as the skin opening as we can. I angle the trocar medially and inferiorly, so the pellets will lay in a dependent portion. Then load the pellets into the trocar and gently pass the pellets, push the pellets through the trocar and pull back as you push it in. Sometimes you'll need to reinsert the sharp portion of the trocar to reposition your close to the skin edge. Depending on how many passes I'll do with the trocar, I'll either use a V technique or a Y technique. So there'll be parallel tracks of pellets. So if I'm doing 3 passes, it'll be a Y with 3 passes. If I'm doing 2, there'll be 2 parallel tracks of pellets. Then a little betadine, a little pressure. So the key points here are you want to have a nice wide long field of anesthetic. I do that with 2 passes of the needle, and in injecting the local anesthetic, you're really creating a space where the pellets will sit. The fluid will dissect the fat and make it easy to push the pellets through the trocar. And as you can see, it should be little or no discomfort to the patient. We then put steri strips over the wound, covering both the little nick we made in the skin and the needle sticks for the local. And I'll cover it with a Band-Aid. And then I like to put ice on it for approximately 5 minutes, a little cold, sorry. And your assistant will be able to hold the ice with a little bit of pressure just for a few minutes.